Hello, everyone, and welcome to the Meet the Candidate session for the Society for Total Worker Health Board of Directors. I'm Lily Tenney, past president, and I'll be moderating today's conversation. This session is designed to give you, our members, the chance to get to know each of the candidates, hear their perspectives, and understand what they hope to accomplish if elected. We're very, very grateful to each candidate for their willingness to serve and to all of you for joining us. So here's how the hour will work. Each candidate will begin with a 2-minute introduction. Then I'll ask a series of moderated questions, ask each candidate to have 3 minutes to respond to each, and then we'll close with some final 1-minute statements for each candidate. I'll be keeping time to make sure we hear from everyone equally and stay on track. Before we get into it, I'd like to also provide a big thank you to this is not a 2024, this is our 2025 board nominating committee. Lee Newman, Serena Rice, Shanna Dunbar, Danica Fairfax, Karen Heaton, and John Doney. They put in the hard work to get us a wonderful slate of candidates here today. Running for president-elect, I'm happy to introduce Dr. Heidi Hudson, Commander of the U.S. Public Health Service, and Dr. Hudson will be serving and is serving in her personal capacity. And Dr. David Daniels, founder of IDT or ID2 Solutions LLC. Our two candidates for secretary are Dr. Manny Berenji, Chief of Occupational Health at the VI in Long Beach, and Christina Lausenberry, PT and owner of Instructional Strength Work Rehab Center. At this point, I'm going to stop sharing my screen and I'm going to start with introductions. Dr. Heidi Hudson, let's begin with you. Please tell us briefly about your background and what drew you to Total Worker Health.
Thank you, Lily, and thank you, everyone, for your time today. And it's a pleasure to be here. It's really an honor. And I want to reiterate that I am speaking in my personal capacity. While I continue to serve in my federal role, the views I share are my own and not those of the National Institute for Occupational Safety and Health, CDC, or the U.S. Public Health Service. So for over 20 years, I've worked at the intersection of research, policy, and practice, focusing on protecting the safety, health, and well-being of workers nationwide. What's guided me throughout is a deep belief in the power of science, service, and collaboration to create real-world impact. I've helped lead the foundational resources for the total worker health community, like the fundamentals of total worker health, the hierarchy of controls applied to NIOSH Total Worker Health, the Total Worker Health in Action newsletter, and the registration of the trademark. I also served as the lead editor for the first international textbook on total worker health published by the American Psychological Association. And I've supported proudly the growth of the 10 Centers of Excellence and the 60-member affiliate program. I've worked with NIOSH leadership and the Office of the Surgeon General on national initiatives to support workplace mental health, social connection, and broader workplace supports. I've also shaped research and practice agendas and contributed to key convenings, including the first international symposium to advance total worker health, and recently serving as scientific co-chair up until January. Today, we face real challenges, and that's why I'm here. I believe in the society's role is more critical than ever, and I'm excited about the opportunities to help shape its future. I believe the society has an essential role to play, equipping professionals with knowledge, tools, and networks to address complex realities of work today. And as a leader, I would focus on ensuring society remains both a thought leader and a trusted partner, building bridges across disciplines and other societies, translating science into practice, and advancing our shared mission to protect and promote the safety, health, and well-being of all workers. Thank you for your time and everything you do to move this mission forward.
Thank you, Heidi. Let's move to Dr. Daniels.
Well, first of all, thanks for the opportunity to participate in the forum, and best wishes to all the candidates seeking to lead our organization. I'd also thank those of our members who've taken time to participate in this really crucial segment of the society. So my journey into total worker health began in the fire rescue service, where I served as a chief officer and saw firsthand how theoretical safety models often fail to account for the very real physical and psychological toll of high risk work. I realized that physical safety alone wasn't enough. We needed frameworks that addressed invisible harms, systemic inequities, and emotional realities of work. That realization led me to pursue a PhD in occupational health and safety, author a book on psychosocial hazards, and earn a certificate in psychological health and safety. But more importantly, it shaped my lead. From leading citywide safety programs to founding national initiatives, I've worked to embed dignity, inclusion, and equity into organizational systems. What drew me to the total worker health movement was its holistic approach, its recognition that worker well being is shaped not just by policies and procedures, but by culture and equity and voice. And as a member of the advisory panel currently of the society, I've helped advance that vision through governance, out strategic planning. And across my nonprofit board service, I've championed worker health and safety as a cornerstone that makes safe places and spaces. I believe that total worker health is more than a framework, it's a movement. And I'm committed to help grow, evolve,
David, we have you.
reach workers and communities who need it most. Thanks very much.
Thank you so much, David. You froze a bit at the end, but we got 99.9% of it. So thank you. Let's move to Christina.
Hello, I'm Christina Lounsbury. I'm very excited to be here today to kind of share ideas with everyone else. I am a licensed physical therapist in the state of Louisiana. About 20 years ago, my husband and I opened up our own rehab facility, and we started specializing in workman's comp, return to work, and functional testing. And kind of since that time, we've branched out into light duty management, accommodations, some on-site services, and training. We're in Lake Charles, Louisiana, so down on the Gulf Coast. So we work in a variety of companies. So the petrochem industry, locally we work with Firestone, Phillips 66, Citgo, the LNG companies, the chemical companies, and then of course the local municipalities. So it's really interesting. We have quite the variety of industry down here, and in our facility, we've been able to simulate most work tasks, and that's been great. But what got me interested in total worker health was in 2020, kind of after the COVID shutdown in August, we had a major hurricane in the area, Hurricane Laura, which took out most of the town. And then approximately 2 months later, we had Hurricane Delta come through and wipe out the rest. And so this entire area is about 5 years into recovery. And one of the biggest issues that our client companies are coming to us with now is retention, and why people can't stay at work and why there's so much sick leave and they're having to leave. And so looking into that for them, I found the Total Worker Health Program about 2 years ago and joined the society, the event planning committee, and really delved into it. And really everyone loves it here. And so they're embracing it and they just want more and more information. And they love the fact that the idea is more than just medical findings or health, but that there's all this other array of things that can affect their workforce. And so that's what I hope to gain going forward is more information and be able to share more information. So thanks for considering me.
Thank you so much, Christina. Last but not least, Dr. Barinji.
All righty. Well, thank you so much, Lily, and it's a great honor to be with you all today. I have a great number of candidates here, and I'm just so glad that we're all in this together, given what's been happening over the last year. I know a lot of us have been going through it, in our respective neck of the woods, but I'm really running today for the position of secretary to really start working on developing coalitions across HR, across occupational health and safety, working with our private partners. I think we're at that critical inflection point where the society can really start to make some headway in how we actually can create this overarching coalition of interested stakeholders who really want to propel total worker health to the next level. As a physician, I have lived and breathed total worker health. I've been practicing now for over 12 years in a variety of different healthcare settings. But every single day, I bring total worker health to the clinic, and we apply these principles every single day in our practice. And I think really trying to essentially get the message out about total worker health to other interested parties who maybe think that total worker health is pretty much dead. I mean, I've talked to so many folks in the last few weeks about total worker health, and there's still a lot of misconceptions about what's been happening. So I think we need to take it upon ourselves to really seize the moment and really try to advance the work that has been done. And I think the society is a perfect platform for that. People really want to do this work. And if we can actually find ways to operationalize a lot of these principles and apply it to a variety of different private sectors, I really think the society can be that catalyst to help advance a lot of these policies. So I'm really honored to be running for the position of secretary, and I'm hopeful that we can continue to build coalitions. And I'm happy to be a part of that. Thank you.
Thank you. Thank you so much to all of you for those great introductions. You all touched on my first question, but I'll ask it and allow you space to expand or elaborate more on what inspires you most about being part of this society. And so, with that, I'm actually going to flip it and have you go first, Manny. What inspires you most about being part of the society?
So actually, I was very fortunate to join the society as a founding member back in 2022. Honestly, when I saw the announcement come out, I was so impressed with how the society kind of came together very holistically, very organically, really building on the principles that I live and breathe every single day here in occupational health. And to be able to advance this work to a larger audience has been something I've been very interested in. And honestly, I do it every single day. I have my elevator who asks what is or what's occupational health for that matter. So really trying to make sure that we know what we do and we can communicate that clearly to folks who may not necessarily understand that. Case in point, I was talking to a surgeon today about his COVID diagnosis, and he was struggling to figure out what he's going to do with his work schedule. So trying to find ways to kind of troubleshoot in real time, working with his partners in his practice to get coverage and making sure that we're protecting other employees as well as other patients to make sure that we can continue to do what we do. I mean, that is total worker health in a nutshell. Making sure that we're protecting each other and making sure that we continue to do what we do. So this is something that's really personal for me, being able to apply these principles and really trying to take it to the next level. Again, I said this in my introductory statement. I think we're at that inflection point where the society can really take off and private industry really wants to do this. So let's do this together.
Thanks, Manny. Christina, what inspires you most?
So, what inspires me the most about the society is that the society itself uses total worker health principles. I joined it, and it was immediately about inclusion and not so much your experience or background, but just the passion that you have for the field. Even the interview questions just to lead the society are about what are your interests, what are your goals. It's stakeholder interest. And coming from a background in regulation, where I was a regulator at the state and national level for physical therapy, it's inspiring to see that total worker health is more than a regulatory checkbox, that it's actually about input, it's actually about collaboration, it's actually about taking ownership and speaking up for what you want. And so that really inspires me. And then I'm also inspired by the fact that employers want it, employees want it. They don't know what to call it, they don't know the name, but when they speak about it, what they're speaking about is total worker health. And so I think this is a great time to kind of make successful decisions and help people be successful. And I want to be part of that success. And so I'm inspired by the whole thing.
Thank you, Christina. David Daniels, what about you?
So, what inspires me most about the opportunity to lead the society is the opportunity to shape not just the society, but a movement, something that redefines what it means to protect and empower workers. That it means not just physical protection, but psychological, social, and systemic protection as well. So, through my career from a fire chief to a safety strategist, I've seen again how traditional focuses on just physical hazards, they fall short. That focus on compliance and physical hazards overlooks the invisible harms that erode dignity and belonging and mental health. And that gap is what led to my academic pursuits. It inspires my efforts as an author, and it drives my involvement across multiple organizations. But most importantly, it's what led me to the society. So what inspires me about the society really is its boldness. It doesn't settle for incremental change. It challenges all of us to rethink the very foundations of workplace health. And as someone who's led, local government safety initiatives and chaired national ones, and serving as the advisory panel chair, I see the society as a platform for systemic transformation. It's where research meets advocacy and policy meets practice, and equity becomes a pillar, not just an afterthought. So I'm especially inspired by the diversity of voices within the society, from public sector leaders to grassroots advocates. We're building this coalition that reflects the full spectrum of worker experiences. And as someone who has worked with and been a part of underserved communities and led important efforts across multiple boards, I'm committed to ensuring that our leadership reflects that same diversity, because representation isn't just symbolic, it's strategic. So leading society to me means activating the tools I've built around equity governance, strategic outreach, and this deep understanding of how systems shape outcomes. It means creating a space for healing and innovation and bold experimentation. It also means asking hard questions, such as how we measure things like psychological health and safety. How do we support marginalized workers? And how do we transition from just awareness to accountability? So ultimately, what inspires me is a chance to lead with purpose, to have this society not just grow, but evolve, to ensure that total worker health becomes the standard, not the exception. And to do this in a way that centers, again, dignity and inclusion and systemic impact at every step of the journey.
Thanks, David. And Heidi, what inspires you most?
Thank you, Lily. What really inspires me about the opportunity to lead the society is a chance to serve this community in a way that feels deeply personal. I want to see the success, especially during these unprecedented times where it's unclear how workers will be protected. For over 2 decades, I've worked to advance total worker health, not just in theory, but in practice. And I want to be part of it. I want to continue to be part of it because we all know what's happening. And I helped build the infrastructure and shape the national guidance, support other steps in this space. And I've done it because I believe in the mission. I believe in the power of science, collaboration, and public service to improve people's lives, especially those workers who've often go unseen and unheard. Right now, there's so much uncertainty in public health in the very institutions meant to protect workers. So we need strong, independent platforms like the society more than ever. And I want to be part of that. I want to help continue to move this mission forward. What excites me most is not just a leadership opportunity, but a chance to help grow something that matters, to create a space that brings people together across disciplines and backgrounds, nurtures new voices, national and international, that keeps total worker health moving forward boldly and with purpose. So that's the kind of leadership I would be honored to bring to the society. I understand it's not just about generating knowledge, but it's about generating meaningful practice and also creating a home, a premier home for all the professionals that want to be in this space and move this forward.
Thank you, Heidi. Thanks, everyone. We'll move to my next question. Very important question. If elected, what is the single most important priority you want to accomplish in the next year? Christina, let's start with you.
Well, this one is pretty easy for me. So I want to establish the society as the resource for everything total worker health. I want the members to know that you don't have to go out and reinvent the wheel. That you're not the only one looking into these issues. There's other industries, there's other professions, there's other practitioners who are looking for the same answers. And I think being a member, that the biggest benefit you should have is access to these other subject matter experts. So I don't know if that means creating some kind of member page or website to where we can contact each other or ask questions, or if we just post that, what our area of interest is or what we're working on right now and contact information. But I know that would be really helpful, and I think that's doable within a 12-month period. And it really kind of expands the message of the society and highlights the benefit of being a member. I mean, that is the benefit, is having access to everyone who loves it so much and all doing very interesting things. So I would say that's my biggest goal in the next year.
Thank you, Christina. Manny, what is the single most important priority you want to accomplish in the next year?
Thank you, Lily. So I've had a chance to think about this, and honestly, I've already been doing this. We really need to focus on coalition building. Right now, given all that's been happening with NIOSH, we really need to take it upon ourselves to build coalitions with other entities. I mentioned this before, human resources, for example. There are a number of human resources organizations like SHRM, for instance. They have tens of thousands of members. And honestly, they need this information like now. So how do we actually start to build these coalitions? How do we bring, folks from the HR universe? How do we bring folks from industry? I know there have been some great highlights from the society, specifically looking at working with small, medium-sized employers. But I think we really need to scale. And I think we actually have enough to be able to build these cases up, but we really have to have a way to get the messaging out. And I'm talking about getting on the road. If I'm elected, I'm happy to go to conferences. I'm happy to meet people right at their companies, making sure that we're actually bringing total worker health to life. It's not just some abstract concept that we read in a paper. It's actually really happening, and it actually demonstrates real outcomes. So I think being able to build these coalitions with partners that we're continuing to build those evolving relationships with, I think that's going to be key. And that's something that I'm prioritizing right now, because that's really going to be the lifeline of the society. If we can build that coalition of interested stakeholders who really, really need this information now more than ever.
Thank you, Manny. Heidi?
Sorry. Thank you for the question, Lily. And if elected, my top priority would be to strengthen the society's role as a connector. Building on Manny's strategy, I think one of the things that the society needs is a revenue and innovation task force. So something that brings member-led groups together to design and develop revenue strategies, but also builds internal leadership and sustainability, drawing from this emerging professionals, both new early career professionals and professionals that are just coming in after a seasoned career. So engaging professionals from all different disciplines in occupational safety and health, organizational sciences, behavioral health, as well as public health. So some strategies would be, of course, the president-elect position is a 3-year term. So there's opportunities to do short-term and long-term activities. And I think that the focus needs to be on both in this particular position, both looking at short-term strategies and long-term strategies to ensure the sustainability of the field. Some strategies would be to strengthen the infrastructure and operational capacity to support the long-term growth and the member engagement, engage cross-sector partnerships, such as what you have already been doing with the American Industrial Hygiene Association, the American Occupational Nurses Association, AOHN, ASSP, and other important partners that have been at the table, maybe not at the society's table, but have been at the total worker health table, and draw our members to do that. Support early career professionals through membership, education, and leadership development. And also, I think there's an opportunity to monetize our content, to really acknowledge some of the work that's been done by our members that's not really highlighted anywhere else. So thank you for the opportunity to answer this question.
Thank you, Heidi. And David.
So, Lily, I've served on more than a dozen nonprofit boards, from national institutions like the National Safety Council, the International Association of Fire Chiefs, to grassroots and community organizations. Chaired finance committees, led governance reviews, helped build bylaws from the ground up. And what I've learned is that mission alone isn't enough. A vision without structure is just aspiration. So to truly lead, we need operational capacity, sustainable funding, inclusive governance, and a strategic outreach that reflects, again, the diversity of the workers that we say we want to serve. So think of it like building a structure. You don't determine the depth of the foundation by a simple ratio. You have to calculate the building's weight, the soil strength, the environmental conditions it's going to stand. And the same is true for the society. We really need to assess our organization's load, our programs, our partnerships, our ambitions, and ensure our foundation is engineered to support it. That means investing in board development, refining our bylaws, expanding our funding streams, and building systems that are contemporary, equitable, and scalable. So this isn't just administrative work, it's mission critical. Because if we get the infrastructure right, we unlock the full potential of total worker health. We become not just a hub for thought leadership, but a catalyst for systemic change. We move from being a collection of passionate individuals to a coordinated force that can influence policy and shape practice and elevate worker dignity across all kinds of sectors and industries. So that's the work that I'm really interested in leading, and that's the foundation I'm committed to building. The priority for me is building the infrastructure so the society can be the best that it can be with the great folks who have come and become members of the society.
Thank you so much. Next question. Heidi, I'll start with you on this. What unique perspective or skill do you bring that will strengthen the board's leadership?
Thank you for the question, Lily. I bring a blend of experience in research, practice, and cross-sector leadership, shaped by over 2 decades of federal service and a career rooted in advancing worker well-being. My work has consistently focused on making science accessible, actionable, and equity-centered, whether by developing national platforms like the Total Worker Health in Action newsletter, or a webinar series providing free continuing education credits to a new and emerging field, or shaping foundational guidance such as the fundamentals of total worker health. What sets my leadership apart is my proven ability to convene diverse voices from occupational safety and health, health promotion, public health, behavioral science, policy, and organizational leadership, and co-create solutions that reflect the complexity of today's workplaces. I've led interdisciplinary initiatives across agencies, built coalitions with academic, nonprofit, and labor partners, and contributed to national strategies on mental health, worker well-being, and organizational resilience that provided structure for workplaces and professionals. In addition to my technical and strategic background, I provided governance experience from serving on interagency steering committees, advisory groups, and cross-sector task force. These roles have strengthened my belief that a strong governance is not just about structure. It's about shared vision, accountability, and trust. If elected, I would bring a collaborative, systems-minded approach to the board's leadership, one that builds on society's existing strengths while creating a space for innovation and fresh thinking. I would listen actively, align priorities and with members' needs, and help translate bold ideas into meaningful action. My goal is to help ensure the society remains inclusive, transparent, and future-facing, well-positioned to support both the evolving needs of professionals and the changing world of work.
Thank you, Heidi. David Daniels.
So I think the most, matter of fact, I'm sure the most unique perspective I bring to the board's leadership is that of a pracademic and solopreneur, someone who bridges rigorous scholarship with real world application, who leads with purpose rather than self-preservation. So as a pracademic, I spent decades translating research into practice. My research regarding psychosocial hazard identification, assessment, and mitigation reflects deep commitment to evidence-based approaches. But I've also served, again, as a fire chief and a safety executive and a national safety strategist. I understand how policy meets reality and how systems must support both compliance and compassion. So as a solopreneur, I operate independently. I'm not beholden to institutional politics or federal limitations. My leadership is grounded in purpose, not position. And that allows me to move boldly and responsively in service of the society's mission. I can make decisions with the organization's best at heart without the pressure of protecting a job title, a funding stream, or a political position. So that freedom allows me to lead with integrity and transparency and a long-term view of what's best for the society and the movement that it leads. So again, I've served on more than 17 nonprofit boards, often founding and governance roles. I've, again, chaired finance committees and led equity initiatives and, again, built bylaws from the ground up. I know what it takes to move an organization from vision through infrastructure to application. And I understand that leadership isn't just about strategy, it's about stewardship. Ultimately, I bring a perspective rooted in lived experience and academic rigor and values-driven independence. I'm here to help the society evolve. Again, not just as a thought leader in total worker health, but one that is resilient, inclusive, and mission aligned. And that's the kind of leadership I believe this moment calls for. It's the kind of leadership I'm ready to offer.
Thank you, David. Christina.
Well, we have a saying in our program that we put research to work, and that's what makes us different than other facilities in the area. And, you know, I don't work in an academic or government setting, so to access research takes some time. Like, I really have to want to know. But once I have the knowledge, I immediately put it into action. And I think that that would be something that I could bring to the secretary position. I love sharing ideas. I love the discussion, the transfer of knowledge, and all those types of things. I appreciate that. And but I'm a person of action. And so working as a consultant to these major companies, they formulate ideas and inspiration, but I'm expected to execute it. And so I'm used to deadlines and producing results and being accountable for the ideas that they actually come through on what I promise. And so I would like to see that as I move forward in the secretary position, the action part of it, the execution in terms of some of the things the society already has to offer, and making sure that they're out there for the members.
Thank you so much, Christina. And Manny.
Yes, so unique perspective or skill. I would say I bring agility. And I think in this moment, we need agility more than ever because we have to maneuver through all of these challenging situations that we're finding ourselves in. As a physician, I'm used to putting out fires on a daily basis. I'm actually pretty good at it, being able to understand what the issues are and coming up with a plan in real time, a practice, but I've had decades worth of practice. And I think being able to respond in real time to situations, especially given what's happening right now, we really have to think outside the box because, quite frankly, the old rules don't really apply anymore. And, just in the last couple of months, I've really had to take it upon myself to save our residency program. I'm the site director for our occupational and environmental medicine residents here at UC Irvine. And given all that's been happening with NIOSH, we really have to start really leveraging our contacts out in private industry. And I'm happy to say that through my networking and through my due diligence and perseverance, I've been able to actually get State Fund, which is the largest insurance carrier here in the state of California for workers' comp care, to actually want to help fund two of our occupational medicine residency programs here in the state of California. So that's the kind of leadership that we need. We need boots on the ground, being able to address what's happening in real time. And again, bringing that agility into focus. How can we actually reach across the aisle to other partners who may be willing to work with us, but didn't really understand what we did? I think we need to create a society for total worker health 2.0. I think being able to really advocate for ourselves and really communicate what we bring to businesses across the US. We really need to be able to amplify our messaging and scale. And I think we have all the critical elements to do so if we're able to band together and really start to work on our platform. How do we start reaching out to private industry? How do we start reaching out to other partners who maybe for all intents and purposes would love to work with us? How do we bridge that divide? I think we have the critical resources within our organization to do just that.
Thank you, Manny. My last question before we go to closing statements. And David, I'm going to start with you on this. How do you see the society amplifying its impact on workers, employers, and communities in the coming year?
So again, Lily, I see the society amplifying its impact on workers, employers, and communities by evolving from a respected thought leader into a fully activated organizational force, one that not only advances the practice of total worker health, but builds the infrastructure to sustain and scale that impact. So the practice is well developed. We have research and frameworks and passion to match, but the society as an organization is still maturing. And that's where I believe the most incredible opportunity lies. In the coming years, we can shift from being a convening body, investing again in nonprofit infrastructure, funding, building systems that reflect the equity-centered values we advocate for. And I've seen what happens when organizations try to scale without a solid foundation. It's again like constructing a building without calculating the load. And again, that simple, ratios just don't necessarily get where you need to be. And so the same is true for the society. If we want to carry the weight of national leadership, we got to build a foundation that's deep and resilient and responsive to the realities of our field. And so that foundation allows us to amplify impact in three key ways. So for workers, we can create tools, training, and advocacy that center the psychological health and safety and dignity and inclusion, especially for those in underserved and high-risk environments. For employers, we offer strategic guidance that moves beyond compliance toward cultural transformation, helping these organizations operationalize total worker health in ways that are measurable and meaningful. for communities, we can be a trusted partner in healing and prevention and connecting local voices to national policy to ensure that our work reflects lived experiences, not only of those most observant, but of those most affected. So that impact isn't just about growth, it's about alignment, aligning our structure with our mission, our outreach with our values, our leadership with the communities that we serve. And that's how we amplify impact. And that's the work that I'm certainly ready and interested in leading.
Thank you, David. Heidi, I'll ask you the same question. How do you see this society amplifying its impact on workers, employers, and communities in the coming year?
Thank you, Lily. We're at a critical moment in public health and in occupational safety and health. Across sectors, we're seeing rising mental health needs, increasing chronic diseases, and new challenges affecting workers. At the same time, with the reductions in our infrastructure in public health and occupational safety and health, this raises concern about our national capacity to respond effectively. And this is a time for the society to lean in. And a lot of work has already been started by the society with its collaborations with the American Industrial Hygiene Association and other partner organizations. These are not partisan issues. These are shared public health concerns that impact workers, employers, and communities across the country. And that's why I believe the Society for Total Worker Health has an important role to play. In the coming year, we can amplify our impact by engaging with our members more deeply, fostering cross-sector partnerships like with ASSP and AIHA, labor organizations, and other partners that are at the Total Worker Health community table, helping to translate that research into solutions and meet real-world needs of today's workers. I mentioned before strengthening the infrastructure by building a revenue base to support the long-term impact, forging these partnerships that extend our influence, and leading boldly into spaces where worker safety, health, and well-being are being redefined. And we can draw from our leadership within the organization and our members to ensure that they are leaders in their communities and build the supports that they need. So again, this is a time for inclusive science-based leadership, and the society is uniquely positioned to help lead that change.
Thank you, Heidi. Manny.
So when we talk about amplifying, we really want to leverage our technological tools. And I know the society has really been at the forefront when it comes to education, but I think we really have to lean into our technological tools to be able to give workers technological advances that they can use in real time. I know I'm currently working on a project around heat stress, and a lot of employers want to be able to use wearables and they want to be able to use sensors. But we kind of have to approach this through a very nuanced perspective. We got to make sure that we're weighing the trade-offs. The wearables and the sensors can really provide real-time information so that supervisors and frontline managers can make the appropriate decisions to take someone out if it's too hot. But at the same time, we have to respect confidentiality and digital privacy. So I think the society can be a great for being able to advance the technological advancements to a variety of different industrial sectors. I think that's really where the society can make its mark because we have all the foundational pillars. We have the research, we have the scientific backing, we have the personnel who have done this work. But I think the implementation part, especially now with all of these technological advances, I think that's how we're going to be able to amplify what we do to a greater audience who may be receptive to learning more about how these tools can help their workers on the front lines or how employers can actually develop these dashboards so they can interpret what's happening with their workers and make evidence-based informed decisions about their health. So to me, the way that we amplify is that we take these technological tools and we're able to bring them to the forefront. And again, being able to address these issues and being able to ensure that employers have everything that they need in their toolkit to better protect their workers.
Thank you, Manny and Christina.
So, well, I have more of a small grassroots perspective to amplifying. Um, I think increased collaboration, as other people have talked about, but with other professional organizations, even, I think researchers getting the information straight to the employees is obviously a good thing. For example, I know David Shapiro did a lot of studies on substance abuse in the maritime industry. Why not take that information and offer it to the maritime schools, to the unions, to other organizations associated with that? And put it out there where they can access it immediately. And yet it also forms a collaboration in the opposite way, and the fact that now you would have access to a workforce to do more research on. Right now in our area, we're having a really difficult time with the emergency response teams and firefighters retiring, extremely shorthanded, completely overwhelmed. I contacted Texas A&M, and they have agreed that they will come in and help us find total worker health solutions. And in return, I have 6 fire departments that they're going to data collect from to look at some of the other things they've been looking at in Texas and just add and expand their research. So I see the society's impact amplifying in that way, kind of more of a quid pro quo or symbiotic relationship between the different professions and employers and the research institutions. I think they could both benefit from that relationship. And that's the quickest way to get the information out there.
Thank you for so much. Thank you for sharing your perspectives. I can tell all of you would actually work really well together. We'll wrap up with a 1-minute closing statement from each candidate. Before I do that, I do want to remind you that David Shapiro, who serves as Assistant Director of Programs and Partnerships at the Centers for Health Work Environment, is running for treasurer unopposed and has provided a statement saying that he looks forward to continuing to serve the society as treasurer, helping to ensure its financial health and investing in opportunities that benefit our entire community. So we'll end with these 1-minute closing statements from each of you. Please share in one sentence why members should vote for you on September 12th and one hope you have for the society's future. Dr. Berinji, we'll start with you.
Thank you, Lily. So I really am excited to be able to move the society to the next level. And I think I bring all the critical skill sets, my Rolodex of folks from all across the industry, being able to think outside the box, especially given the times that we live in. We need folks who are actually able to not only talk the talk, but walk the walk, and really looking for those funding streams to keep our programs alive and thriving. I've actually done this work in the last few months, and it was challenging, but I was able to really kind of dig in and really focus on what drives me as an individual and what we need to do together to be able to advance the work that we do every day. So I would love to be able to engage in this work. This really excites me, and I would really appreciate your vote for secretary. Thank you.
Thank you, Dr. Berinji. Christina, your closing statement.
Yes, well, it's hard to put into one sentence, but I think that moving forward, if you were to vote for me as members, it would be voting for yourself, because it's all about inclusion, and you will be included and you will be contacted, no doubt, because I think together we could move from knowledge to know-how, which I think are completely two different things, right? There's knowledge and there's knowing how to get something done and how to implement that knowledge. And so I hope the society continues to develop knowledge and information and protocols and all the things that are so needed, but that we also start taking it a little bit more into the field and teaching people how to use it.
Thank you so much. David.
So members should vote for me because as an academic and solopreneur, I bring decades of nonprofit leadership rooted in safety, focused, and equity practice that's guided not by institutional ties, but by an unwavering, values driven commitment to advance the society's mission with integrity and independence. And my hope for the society is that we'll heed the words of Beyonce. Don't just talk about it, let's be about it.
Thank you, David. And Dr. Heidi Hudson, your closing statement, please.
Thank you, Lily. And I'm truly honored to be a candidate for president-elect. And I want to thank each of you for the work that you do each day to advance the field and for the opportunity to share my vision today. I bring deep experience, proven leadership, and a longstanding commitment to building systems, partnerships, and practical tools that form the foundation of total worker health. And I've spent my career not only advancing the science, but ensuring that it's usable, accessible, and equity centered. In this moment of uncertainty, our work has never been more urgent. We need bold, strategic leadership that understands what's at stake and is prepared to act. I remain deeply committed to sustaining and evolving the integrated science-based approaches we built together, and to ensuring they continue to thrive in these new contexts with new audiences. My vision for the society is ambitious but grounded: to grow the Society for Total Worker Health into a dynamic, resilient, and inclusive home for professionals, one that accelerates the adoption of total worker health, expands its reach, and cultivates the next generation of leaders. That means strengthening our infrastructure and revenue base to support the long-term impact, forging our cross-sector partnerships, extending our influence, and leading boldly in spaces where worker safety and health and well-being are being redefined. We have a real opportunity to shape the future of our field, not just respond to change, but to lead it. And I'm ready to bring my experience, my energy, my strategic focus as in the role of president-elect, and I would be honored to have your support. Thank you for believing in this mission and for all you do to protect the safety, health, and workers everywhere.
Thank you again to our candidates for your thoughtful responses, to our members for joining, again to our board nominating committee for the work they put in to get us to this stage, and to our current existing board of directors and engaging in this important process. So we encourage all of you to cast your vote on September 12th and help shape the future leadership of the Society for Total Worker Health. That concludes our session. Have a wonderful day.